Okay, anticonvulsants. Sometimes the kids are started on medication for seizures, and you go, well, why? They don't even have seizures. What's with this? So the seizure medications or the mood stabilizers are indicated in mood disorders. And the main mood disorder is bipolar disorder. You also have a form of psychotic disorder that is a combination of schizophrenia, bipolar disorder, schizoaffective disorder, that you can also use mood stabilizers in. Mood stabilizers can also be used in refractory depression, right? Depression that does not respond to antidepressants. You even tried an antipsychotic on it, doesn't work. So you can use a mood stabilizer or try to augment to help the response to the antidepressant with a mood stabilizer. So what type do we have? We have Depakote, Lamictal, Trileptal. Again, all are seizure medications. And these are medications. There was a question about levels in the bloodstream. Well, these are medications that we can get levels on, especially the Depakote. Trileptal and Lamictal, we can get them, right? But it's not the common practice to get those lab levels. Why do we get Depakote? Because Depakote can affect the liver, and we need to get liver function tests, and Depakote can cause toxicity. So we want to make sure that that the serum levels are not too high, because then the risk of toxicity is higher as well. Okay. What are the main problems with these medications are cognitive issues. Depakote decreases cognition, or can decrease. Lamictal can also, and Trileptal to a lesser extent, but is less effective in mood disorders. So you have a child that has bipolar disorder, brilliant child, very creative. They have bipolar disorder. You need to control their bipolar because they're very aggressive, they're miserable, and then you start them on the Depakote. Their mood is stable, but now they've gone from A's and B's when they are doing their homework and doing their schoolwork to C's and D's, and they're just they're not able to process quickly. So that's one of the possible side effects to these medications. Does that mean you take them off the medication? Risks and benefits, right? Because bipolar disorder, there is a high risk of suicide attempts and suicide in bipolar disorder. So again, you have to measure, you have to put risks and benefits on a balance and kind of deal with these issues. In Depakote, we already mentioned cognition, we mentioned liver function. It can affect the liver. It increases the appetite. If you have a child on Depakote and on an antipsychotic, appetite is a big issue. And of course, we have to help them, and that's when diet also comes in, right? Because we have to make sure that they're on a proper diet. Okay, then we have Lamictal. Lamictal also a seizure medication. The main issue with Lamictal, excellent medication. You don't have to get lab draws on it, but Lamictal has been shown to cause something that is called Stevens-Johnson syndrome. Stevens-Johnson syndrome is a drug allergy, and so they break out in this drug allergy. The problem with Stevens-Johnson is that it's very quick, it affects mucosa, and it's fatal, right? So you definitely want to pay attention to this. Lamictal is a medication that you have to start very slowly, and you're kind of focused on the drug rash, okay? Now, that in mind, it is not frequent. Aspirin can cause Stevens-Johnson, right? The anti-inflammatories can cause Stevens-Johnson. So a lot of different medications can cause Stevens-Johnson syndrome, or the drug allergy that this one causes, that can potentially cause. So it's not only for the Lamictal, but it's something that we have to pay attention to. Other things that we have to pay attention to with medications, and this is a general comment, is that kids in the summer in San Antonio go out and play, right? So they can become dehydrated. And when kids become dehydrated, their medication levels can go up. And we'll talk about that in lithium particularly. But it's very important to keep kids hydrated. Many of these medications also cause photosensitivity. In other words, they can get sunburned easily. Okay? So it's very important for the kids that are on antipsychotics or on mood stabilizers to have sunscreen constantly. They go to the pool, they need more sunscreen because they can get burnt easily, or they break out in a rash also. Okay? That can happen commonly with Abilify as well as with Lamictal. The expected results of the mood stabilizers are to stabilize mood. Okay? Does it mean it's going to make them happy? No, it doesn't, because it's not an antidepressive. Lamictal has a little bit of an antidepressant effect, but mood stabilization is, now they're just angry all the time. Okay, that's a step forward. Okay, now they're not doing this, but they're stable, but they're angry. So now we can deal with the anger part. Okay, or they're depressed. They're stable, depressed, or they're stable, even hypomanic. Then we have to deal with those things also. But their mood is not unpredictable. Okay. Why is it important also to use mood stabilizers? Because there is something called the kindling effect in bipolar disorder. The more episodes that you have, the more episodes you are going to have. They kind of accumulate and they become more severe. So in a visual, it's basically, if they're doing this, the natural history is that it's going to go like this, and it's going to be more severe. And it seems like Depakote or the mood stabilizers tend to have a neuroprotective effect. So they protect the brain from that kindling effect. That's why it's also so important for an early diagnosis. Okay, sedatives and hypnotics, basically, don't use in kids, okay? Now, that does not mean that these are bad medications. If you have a child that has panic disorder, panic attacks, right? You don't have time to wait till the antidepressant kicks in. That is a horrible sensation. If every time you have a panic attack, you feel like you're going to die and you can't leave the house, you can't go to school, you're going to need something that helps you in the meantime, right? Which is what we were talking about, the other symptoms. These are medications that can help with that. But you can overdose on these medications. That's one of the limiting factors. 2, you can become addicted to these medications, okay? They work on the same receptors that alcohol does. So you can get withdrawals. You can get delirious when you're addicted to it and you stop the medications. So that's very important. If you can stay away from these medications with kids, it's the best thing to do. You just try to stay away. But again, if there's panic attacks, this would be an indication for these medications. In children, kids can have the opposite effect to medications. So you've heard about the Benadryl, where you give the child the Benadryl for the allergies, and most kids get kind of sedated on Benadryl, and then you have that one child that you give Benadryl, and they do not sleep all night. They're yelling, screaming. It is just horrible for them. They become very agitated. Well, these medications, the Xanax, the Valium, the Ativan, can do that in smaller kids. And then they just become disinhibited instead of calming them down. So that's something to take into account. Okay, then we have lithium. Lithium is an important medication. Lithium is a old medication. It is great. It is fantastic. It works. But you have to deal with potential effects on the thyroid, right? Because it can affect the thyroid. If you use lithium and a person can become lithium toxic, it's a salt, okay? So if you're dehydrated, the lithium levels go up and you start trembling, and it can affect your cognition, and it's not a good feeling. So it's very important that that person maintain hydration, that you do follow labs. Now, when we talk about blood draws, some of us can say, big deal, right? But if you have someone that is very scared of blood draws, a 6-year-old, a 7-year-old, an 8-year-old, or even, a 40-year-old, you have to consider that as a medication maybe not to use, because they might not be compliant, right? They just won't take it because it means that they're going to have to go to the lab and get their blood drawn every, at the beginning, maybe every 2 weeks, maybe every month, and then after that, every 6 months, depending on how they're doing. Benadryl. We already talked about Benadryl. Benadryl helps with sleep. Propranolol is also a blood pressure medication along with the other ones. It works a little bit different, but this medication helps with, can help with anxiety, like performance anxiety, right? So in extreme cases, and I've only used this 2 times in the tax test, but extreme cases where these kids just cannot even get to school on that day, this is a medication that can work for just that day, okay? Now, that being said, it's not FDA approved for that, right? There are not any studies that necessarily say that it should be used in tax tests. But clinically, it's worked, right? So again, we come to those things that we need to, those factors, those topics we need to address when we speak to the parents about using these type of medications. And they need to know because they are the ones that give the consent. They need to know what they're giving their kids. And all those extra, not FDA approved, not necessarily the studies are there, those kind of things, okay? Melatonin. Have you heard about melatonin? Over-the-counter medication. It was used originally for jet lag, right? Well, it helps with sleep. Again, the most important treatment for sleep is good sleep hygiene. Kids with televisions in their room watching, what is it, CSI or whatever that thing is called, until 11 o'clock at night, they're not going to fall asleep. Okay, well, melatonin, you have to be careful because melatonin can make your dreams more vivid. So if you have good dreams, more power to you. Take melatonin. But if you're not having very good dreams, if you're having nightmares, melatonin can make it worse and not a good feeling. Well, thank you very much. We've gone through tons of information, at times scattered, but I hope the messages and the objectives were fulfilled.